today to join these wonderful individuals and colleagues to do what we all should be doing, is working hard to continue to champion and to protect society's most vulnerable populations and families. And I've joined Congresswoman Schakowsky in telling you a story about a constituent of mine in Albuquerque, New Mexico, who is really close to me because she lives with me and is my mother. I talk about her often because I'm living every day, as she is, trying to mitigate the risks that these retired populations have every single day. And the value and the importance of all of these programs collectively. Social Security, their Social Security income annually is less than $16,000 a year. That's too high, by the way, in the state of New Mexico to automatically qualify for Medicaid, which is a broader program. I'm going to talk about the value of Medicaid and that it provides for those long-term care needs for individuals who can't bathe themselves, dress themselves, feed themselves, for a variety of physical or cognitive reasons. And that population in this country is escalating, and yet we aren't really investing if we allow the Republican agenda to begin to reduce and cut these programs and make eligibility even harder. And then families like mine, I can't afford to pay those co-pays and those direct costs. And I will keep my mom, if we have a partnership, healthier, longer, so that she's the example about not spending money in Medicaid. But we don't get that chance if we allow Medicaid to be block granted to the states. And in a state like New Mexico, that would be a 50% reduction. Now, the average beneficiary in my state, who's getting home and community-based services, who's treated with dignity and respect, who's kept out of a nursing home, who's kept out of a hospital, which are the nation's highest cost centers in these programs, highest cost centers, is little more than $13,000 a year, as compared to the average cost of the country for nursing home care, which is $78,000 annually. So in an environment where we are all dedicated to making sure that our programs are efficient, cost-effective, that they grow productively to support these vulnerable populations, we are now talking about doing the very opposite of the Affordable Care Act, which is expanding Medicaid, so that we're getting in early, we're keeping people healthier longer, we're supporting families, we're making sure that these vulnerable populations are protected from abuse, neglect, and exploitation. We are now suggesting that we will give states less money, but spend more per person on the very things that our constituents are asking us to resolve. So I suggest today that this partnership between these programs is a family benefit, that families should be fighting for equity here, that that's exactly why Medicaid was not part of the Balanced Budget Act. It should not be on the table now. We should not be talking about eligibility and benefits. You squeeze it here, as I illustrated, it just pushes out someplace else. What we should be doing is looking for the measures that you've heard by my colleagues, including prescription drug negotiations, but also that we change the delivery system. So it's meaningful, it's fair, it's equitable, it's accessible, and it focuses on keeping us together and keeping us healthier longer. I beseech Congress to continue to think about our family, our seniors and disabled adults, and make sure that these lifeline programs keep hospital systems, doctors in these communities, and people in their own homes for as long as possible, complete, whole,